everyone. I hope you're doing well and you are safe wherever you are and you're carrying out the practices, the safe practices, COVID-19 safe practices. My name is Dr. Krishnan. I'm a pediatric occupational therapist. Just like all of you, my life has also changed tremendously since we've had this global pandemic. I'm an EI occupational therapist and I deal with children. And right now, everything from next week onwards, it will move into teletherapy or telehealth practice so that we are going to be safe and so are our children and families that we're working with. I also wanted to share with you that in the recent weeks, I've had numerous good information that I've been getting or gathering, and I wanted to share with you two organizations or information from where I've gathered these information from that's really going to be useful and pertinent, and I wanted to take this opportunity to do my bit of sharing safe practices. Two places that I want to acknowledge right now is the University of Illinois Chicago. They came up with a flyer so you can download that and use it. It is current information as of March 29, 2020. That's the information that's current and what's really useful. And I've also got information from the WHO, which I think is going to be really useful for all of us to use. Couple of things to remember, a couple of flyers that you can download and print out, especially if you, for yourself. So as a healthcare practitioner, we used to have it by the side of the sink when we went to, after we see patients and we wash a hand, we had that little the little poster there for us to remember how to go through it. So again, it's not a bad idea to have it to make sure that we're very safe and we are doing washing our hands in the right way. Also, if you have children, and we are telling our children to wash their hands, but what's the process of doing that? So we have I have the flyer for that. It's from WHO. This is great, so download that. The other thing I want you to appreciate is all our routines have changed. And so we want to also acknowledge the fact for children who have sensory processing difficulties, children with ADHD, children with autism, this is going to be a really hard time for them to understand because it's happened so quickly. So I appreciate what families are going through because it's almost a cabin fever right now. Most of you have to be in the house. And so with this vlog, I just want to address safe hygiene. And then in the next one, we will talk about routines because everyone's routines have changed right now. And so I acknowledge, appreciate, especially families with children with special needs, that what this means for them. Let me start with a PowerPoint that I've actually set up to share this information with you. Let me start out here. Okay. So this is COVID-19 safe practices I want to share with you. For those of you who don't know me, my name is Dr. Kavitha Krishnan. I'm the owner and pediatric occupational therapist with Healing Synergy LLC. I'm based off North Carolina. This is what I saw on my screen today. This is where the global pandemic is. On March 29th, there's 638,000 people with confirmed cases, 30,000 deaths, and in 202 countries. So we want to pay attention to what's happening and do our bit of staying safe. And what does safe mean? And what are the practices that we need to do? It's very, very basic. Stay home as much as you can. Do your remote work, and also exercise the safe practices of washing hands. As simple as it seems, right? It's important for you and your family to protect yourselves from COVID-19, and the best way to avoid exposure to the virus is to wash your hands. It's a simple thing, we all know that, but we need to wash our hands, and the golden rule or the key to remember is it's 20 seconds, for at least 20 seconds. And how do you do that? You can hum or sing a birthday song twice And we used to do that in the clinic as well. Like in your head, you can sing it, but hey, when you have your kids washing their hands, you can sing it twice for them, with them, to maintain them washing their hands for that 20 seconds. If you do not have soap, then be sure to use the hand sanitizer that has at least 60% alcohol. And for those of you who travel in the car, and me being a home-based therapist, I go to people's homes to provide the therapy. I always have the hand sanitizer in the side of my car, so that as soon as I get in, I have it. I wipe my hands before I touch my steering wheel or any part of my car. So that might be a practice most of you are already doing, but I just wanted to reiterate the importance of if you can, and you are still able to get the sanitizers, because I know it's out of stock. But for those of you who have it, I want you to also use it in the best and most effective way for yourselves. Do not touch your eyes, ears or nose, ears or mouth before you wash your hands, because you can transmit it very quickly. Try to stay 6 feet away from people, and I'll tell you, it was really hard because we don't practice that as much, right? And so I went off to Sam's Club the other day, and as I was standing, I didn't see those markers, on the ground. So pay attention to that, right? So consciously think about it when you go into, especially the grocery store, and people are trying to rush out. They're trying to pay at the cashier, and people are right behind. Just make sure that you are 6 feet away. And some places do have those masking tape on the floor. Pay attention to that. That's what it's asking you to do, to keep 6 feet away. Clean and disinfect surfaces that you touch every day, like your cell phones. Cell phones go everywhere with a lot of people. So make sure you're wiping it clean. Cell phones, table, remote control, people touch that a lot, right? So with your remote control, keys, doorknobs, everybody touches a doorknob to go through. So you want to wipe that down as well. And light switches, right? Throw away all of your used tissues in the garbage right away, because we tend to forget and then we just leave it. Please do not put it in your pocket. Once you clean, discard it immediately. Make it a practice right now. You don't have to wear a mask, but if you are caring for someone who is not well right now, I would definitely urge you to wear a mask if you can. You should wear a mask, really, if you're caring for someone who's ill. So, as we said, WHO has come up with how to wash your hand, right? The duration of the entire procedure they talk about is between 40 to 60 seconds. This is going to be really useful for children, especially children with autism or sensory issues, for them to actually see. Actually, it's beneficial for any one of us to know the exact and proper way of washing our hands, right? So you first wet your hands, you get enough of the soap to cover the whole surface, then you rub the palm to palm, and then you have the right palm over the left top of the hand at the dorsum and interlaced in the fingers, and then you swap the other way. You see this a lot with the doctors, right? And then palm to palm with the fingers interlaced, and then back to back of the fingers to opposing palm with fingers interlocked. You do a rotational rubbing of the left hand, a left thumb, clasp in the right thumb, and you do it both sides. You do rotational rubbing backwards and forwards, and then you rinse your hand and you wipe your hand dry. Now, this is the key, right? So you're wiping your hand with the tissue, and you're going to touch the faucet. So instead of touching with your bare hand, use the tissue, use the towel. Okay, so don't touch the faucet with your own hand, especially when you're outside in public restrooms, right? So you have the tissue in your hand. Once you wipe it, turn the faucet off with that, and then discard the tissue. Your hands are now safe, okay? Protect yourself and others from getting sick. So you definitely, again, want to wash your hands after you cough or you sneeze. When you're caring for someone who's already sick, right? You want to wash your hands before, during, and after you prepare food. Before eating, you need to wash your hands. When your hands are visibly dirty, and also after handling animals and animal waste, especially. you need to wash your hands. To prevent COVID-19, it is safe to avoid physical um, um, physical contact with greetings. So safe greetings include a wave, a nod, a bow, or the whole namaste. We've been seeing that quite a bit. So there are different ways of you doing that. You can actually just wave. Again, I know it's hard. A lot of times people like sending their hands and then they're pulling it back. But hey, you can make it fun, right? Everybody understands it. So make that a practice. What should you do if you are feeling sick? If you have difficulty breathing, then call 911 right away. If you have difficulty breathing, if you have other symptoms, consult with your doctor, call or see if you can message them online, because most of the healthcare practice are all basically are now engaged in telemedicine or telehealth. Like I said, I'm practicing teletherapy right now, even with my kids. If you are sick, make sure you wear a face mask. Stay at home to avoid infecting other people. Cover your mouth and nose with a tissue when you cough or sneeze. Reason for this is this droplets that go everywhere. It goes really far. So when you don't cover your mouth, you're actually transmitting this across to everybody else. So cover your mouth and nose with a tissue. You can use the inner part of your elbow if you do not have a tissue. Make that into a practice. And it doesn't matter. It doesn't just have to be when you're outside, but even at home, because when you start making it a practice, it becomes motor memory immediately for you. If you have family member who's sick, they should occupy a separate room apart from other family members and pets to avoid spreading the virus. If it's not possible for the person who is sick to have their own room or bathroom, they should stay at least 6 feet away from those who are not sick. The bathroom should be disinfected after every use. Really great information that's given from the UIC team here, because we are all asked to stay home now. Somebody can be ill, but what can you do in that instance in helping to prevent it from spreading to everybody else? What should you do if you are undocumented? Okay, so again, right now we have a crisis, and so if you are sick, you have to take care of yourself and seek medical attention. Want to emphasize this, the team from UIC states that right now, at least, right, the U.S. Citizen and Immigration Services will not consider testing, treatment, or preventive care of the coronavirus in the public charge test. So please, if you know anyone who needs it, tell them to go get the help that they need right now. How can I manage my mental and physical health while I'm at home, right? Right now, we are all being forced to stay home, and that might be really difficult for some, right? You want to take a break from watching TV, reading, or listening to the news, including social media. Take a break from it because there's a lot of information that's coming. So take a break to doing something else. Constantly listening to the news about the pandemic, according to this group of this team, says that it can actually cause more stress and anxiety, which is true, right? Because every time you look, you're seeing that the rates are going up higher. And I'm quite sure that some of you who might be in the affected areas are probably more anxious than others, right? Not to say that in the other states we're not feeling it. I'm in North Carolina. I know we're paying attention to it. We're really learning from the other states. And yes, it is quite anxiety provoking. One thing that's really important right now while you are at home is to maintain a routine. Try to maintain a daily routine. For example, you can create a schedule for yourself. So for caregivers and adults, try to create a schedule for yourself and for your children, including learning activities, fun, relaxing activities like listening to music, watching a movie, praying if you're religious. If you're at home, start your day at the same time you would normally start at work. I mean, that's a great rule of thumb. Get up at that time, do your usual routine, and end your work day when you would normally leave work. For many of you, you have remote work anyway, so you want to maybe keep that momentum going, even though you're not physically leaving the house. I also know that most schools are going to start remote learning, right? So that's going to form somewhat of a schedule in your children's lives as well. Um, so try to make sure that you're helping with the routine so that it doesn't become difficult when they have to start sitting down and actually learning that in that medium, right? So they are already getting up at a certain time. They're making sure that they have their breakfast at a certain time, whatever time that they're going to school. Because I know with the schools they're also going to start with their lesson plans soon online. Connect with family and friends. Talk with your friend or a family member. Share your feelings and concerns. Create a strong support group or system because we are all living through this together, right? This is a difficult time, so sharing with them. Take care of your body, take deep breaths, stretch, meditate. Make sure you have a healthy and balanced meal. Try to avoid consuming drugs and alcohol at this time, right? Also, you can do the following activities. You can walk your dog around the block. We do it here, my husband and I, and my puppy, Whiskey, that we have. We walk around, but we all maintain that social distance of 6 feet away from each other. You can also run and exercise around your neighborhood. So again, please follow all the recommendations that have been provided by the state and local authorities and keep your distance from others. If your state, your township is under shelter in place, it would still allow you to go to the grocery store to buy food, to the pharmacy, for you to take a short walk or leave your home for medical reasons. But again, make sure you're only going out when you really need to. Please exercise the safety measures that we discussed. If you have any questions, please feel free to write to me. What can you do while you're at home? You can play board games, card games, you can cook, eat with your family, tell stories. This is a great time. Everybody is at home. Everybody is, some story that you've not told your kids before, or if your grandparents around, this is a great time. Look at family photos. The team also talk about, great time to look up exercise videos on YouTube. The We is great as well, right? Things that you can do at home. You can read, draw, write, color. You can great time to organize and clean your house. Get a jump start on your spring cleaning. Here we've started doing some gardening as well. Like I said, in North Carolina, so it's a little bit warmer, but I see all my neighbors out and we're all doing some gardening. So everybody's getting out and moving about. Call your loved ones, connect with them via social media, listen, dance to music if you can, participate in religious services that are offered on YouTube, Skype, Facebook Live, and say your prayers if you're religious. Thank you so much for taking this time to listen to the safe practices. And you can contact us if you have any information. Like I said, currently we at Healing Synergy are also doing teletherapy services to maintain what's happening right now. And all the flyers and all the information that I had or discussed earlier on, I will also have those links for you to actually download and share with others. Again, stay safe and take care.